All right, let's dive into something that impacts millions of us but is so often misunderstood. We're talking about social anxiety disorder. Let's really unpack what it is, and maybe more importantly, what it isn't.
I mean, who hasn't felt this at some point, right? That knot in your stomach before you have to speak up in a meeting, or that what do I even say feeling when you walk into a party. It's a pretty universal human experience.
But imagine if that feeling wasn't just a fleeting moment of nerves. What if it was a constant, powerful fear that pretty much dictated your entire life? Well, for millions of people, that's their reality, and it has a name.
So first things first, what exactly is social anxiety when we're talking about it as a clinical condition?
Okay, so here's the official definition, but let's break that down. The absolute heart of this disorder is the fear of being watched and judged. It's this deep, intense worry that you're going to do something, say something, or even just look a certain way that'll lead to total humiliation or rejection.
And we're not just talking about big, scary stuff like giving a speech. The fear can pop up in the most ordinary, everyday moments. Things a lot of us don't think twice about, like just having a chat with someone or grabbing a bite to eat at a food court. Those can feel like walking a tightrope.
Now, let's get into how common this really is, because honestly, the numbers are pretty eye-opening. So get this. Our sources point to a lifetime prevalence of somewhere between 8 and 12%. That means up to 1 out of every 8 people will deal with this disorder at some point in their lives. This is absolutely not some rare condition.
And the data shows a pretty interesting split when you look at gender. It's diagnosed roughly twice as often in women as it is in men. Now, the exact reasons why are still being explored, but it might have to do with different societal pressures, or even just how it gets reported. And this is a really key piece of the puzzle: when it starts. The typical onset is right in those super formative years, between ages 8 and 15, a time when you're just trying to figure out who you are and where you fit in.
Okay, this brings us to a super important point. A lot of people are shy, right? So where's the line between that just being part of your personality and it being a clinical disorder?
This really lays it all out. The single biggest difference boils down to one word: impairment. You see, shyness is a personality trait. It might make some things a little uncomfortable, but it doesn't stop you. Social anxiety disorder, on the other hand, actively gets in the way of your life. It can impact your career, your friendships, everything.
So, for diagnosis, a few things have to be true. First, the fear has to be intense and stick around for at least 6 months. Second, it causes someone to either completely avoid social situations or just barely get through them with extreme anxiety. And here's a big one. The fear is way, way out of proportion to the actual threat. And finally, it has to cause real, significant problems in a person's daily life.
And this isn't just a mental thing. Not at all. The body has a very real, very physical reaction. We're talking about a full-on fight or flight response. Your heart starts pounding, you might tremble or sweat, and of course, there's the one so many people fear: blushing.
So after hearing all that, I know what you're probably thinking. What can be done about it? Well, the great news is that social anxiety is very treatable with some really effective, well-researched methods.
The top-of-the-line, gold standard approach is a kind of therapy called cognitive behavioral therapy, or CBT. What's so great about it is that its effects tend to last, often even more than medication, because it's all about teaching you skills you can use for the rest of your life. So what does CBT actually look like? It's a really practical process. It starts with just understanding what's going on, the education piece. Then you learn to challenge those automatic negative thoughts. After that comes the really brave part: gradually facing the situations you're afraid of in a safe, controlled way. And sometimes it also involves building up your social skills and confidence.
Medication can also be a really helpful tool, especially when it's used with therapy. Doctors often prescribe specific types of antidepressants that help balance brain chemistry and can take the edge off the anxiety, making it easier to do the work in therapy.
Okay, let's land the plane here. What's the bottom line? What does the outlook for recovery really look like? And this right here is a huge message of hope. The data shows that with the right treatment, about half of people can reach remission, meaning their symptoms get much, much better within a few years. So yes, recovery is absolutely possible.
And this is a really big but. This quote is just staggering. Only half of the people who have this disorder ever go get help. And when they finally do, it's often after suffering in silence for 15 to 20 years. Let that sink in.
So we've gone through what it is, how common it is, and how it can be treated. After all of that, what's the single most important thing to take away from this?
It's this, right here. Social anxiety disorder is a real and highly treatable medical condition. It is not a sign of weakness, it's not a character flaw, it's not something you can just get over by trying harder. Understanding that is the first and maybe the most powerful step toward getting better.